till midday, this is the morning program with Liam Bartlett.
27 minutes to 10 on this Friday morning. Thank you very much for listening today. You know, yesterday we told you about that decision to make vaccinations compulsory for all health workers around the state, private or public, meaning that if you're working in the health system, the message is very, very clear now from the state government: no jab, no job. Now, today, the Nurses Federation want to take that one step further. The union wants the state government to move to make it compulsory that anyone, staff members or members of the public who enter a hospital in WA, must be vaccinated against COVID-19. State Secretary Mark Olsen from the ANF joins us this morning. Mark, good morning to you.
Good morning, Liam. Thanks for having me on the program.
It's a pleasure. Mark, are you proposing then zero exemptions for those not vaccinated?
Look, I was listening to your earlier callers, Liam, and I think that, first of all, there always needs to be exemptions for compassion. There's no question about that.
Yep.
But generally speaking, anybody, if the aim is to protect both the patients and the staff, then mandatory vaccinations for everybody who enters a health facility is consistent with that aim. Now, that includes tradesmen, that includes visitors, that includes union officials, because all those three groups at the moment are not covered by yesterday's order. And when I spoke with you a little while ago about mandatory vaccinations in aged care, and we survey our members all the time, Liam. I've had hundreds of emails overnight with lots of good questions that I'll be putting to the government about their new policy.
Yeah.
But the resistance to mandatory vaccinations was substantially lowered by three things: choice of vaccine, access to the vaccine, like in-reach programs, and paid time off to get the jab. But the other big one was members were telling me that ensuring the same rules applied to all. That lowered the resistance. That made the staff feel as though everybody was in this together. So if the government is serious about their aim, then they will extend that order to include everybody with only exemptions. I mean, Liam, I don't understand why union officials, for example, have got an exemption, because I can assure your listeners that all of our staff will be vaccinated by the deadlines. And can I also mention, Liam, that that to get into a aged care facility, you have to have the flu vaccine. Now, that applies to my staff. I don't understand why union officials will be given an exemption.
Well, I can tell you, I know why union officials have been given exemptions. That thought was running through my mind when I was talking to our caller, Tony, earlier on. I mean, last year, without vaccines, as you know, there were exemptions given to union officials, and that's probably a result of the fact that a fellow who is very, very prominent in the union movement and very senior in the left wing of the Labor Party happens to be the Health Minister, Roger Cook. What do you think of that idea, Mark?
Well, I think we all know, Liam, that the Health Minister is backed by the broad left of the union movement, and in particular the United Workers Union, used to be the Miscellaneous Workers Union.
Yeah, I don't think it's any surprise.
I would hate to think that decisions are made based on favouring unions. Now, that may sound strange coming from a union official, but I'm a great believer that the rules apply to everybody equally. And last year, I knew that other union officials were out there during the lockdown. And this is particularly relevant to one of your last callers who had such great difficulty. And I had people writing to me saying they had difficulty seeing their loved ones during the lockdown last year. And I was appalled to find that union officials from various unions were out there recruiting members during that lockdown. I can assure your listeners that I gave a directive to our staff that we were not out there. We took all the steps. We withdrew from the hospitals because the hospital had enough problems, both private and public. They had enough problems last year, Liam, without having to deal with union officials running around during that particular period. So if the government's serious, they'll extend this mandatory vaccination to everybody.
Okay, all right. So you're turning around effectively that announcement yesterday. So you want, let's get this quite clear, you want this to be a blanket rule for anyone, not just the health workers, anyone entering a hospital.
Absolutely, Liam. It's inconsistent not to have that position. As I said, there are always exemptions on compassionate grounds. Absolutely. And the same would apply to aged care. So there are always exemptions on compassionate grounds.
Well, that's the way you'd like to see it. But Mark, how would this work physically? I mean, how would you prove, for example, you're going to visit somebody in hospital, how would you prove that you've had the jab? I mean, are we talking the use of a vaccine passport or showing them the vaccine receipt from the health department? How would it work?
I think, Liam, there are various ways you could make it work. You could put people on a visitors register. It doesn't have to be overly bureaucratic. I also know that when we were speaking with the chief medical officer yesterday, look, he's doing a really tough job, Liam. I admire the work that he's doing, and he's definitely a decent human being. Is very considered in the decisions that he makes. But we were having the discussion yesterday about how life will be post-vaccination. And these are the challenges that the government has to face up to, because it's not just going to be hospitals, Liam. It'll be other services. It'll be things like the football, where people will have to prove that they've got some type of vaccination. But just coming back to hospitals, there's no reason why hospitals can't keep a register. They did it last year. You couldn't get into a hospital unless you notified them that you were coming last year. So there are ways and means of doing it without being overly bureaucratic.
All right.
But the intention must be there.
All right, Mark, we'll leave it there. Thank you very much for joining us today.
Thanks for your time, Liam.
Mark Olsen, he's the State Secretary of the Australian Nursing Federation, so that's putting the cat among the pigeons slightly. So, in other words, he doesn't just want his members, the nurses around the state, to have to be jabbed, get a compulsory vaccination. He wants to broaden that out and include everybody. If it's good enough for the nurses and the doctors, then in Mark's view, it's good enough for everybody. Make it compulsory. If you go to a hospital or a health clinic, you have to be vaccinated before you enter. What do you think of that? 133 882. Our talkback lines are open. 20 minutes to 10 on the morning program.